Hi everyone, it's Stephanie here with Healthcare-Edu. If you don't know us, check us out, www.healthcare-edu.com. So for now, I'm gonna go over dressing, okay? We are, of course, we are in Massachusetts. Our state exam is the HD headmaster. So I'm going to do addressing a client with an affected weak side. But before I show you the skill, I want you to take your paper and write this down exactly as it is here. An affected or weak side, they're basically giving you a scenario of someone who's had a stroke. And on YouTube, I've talked about the FAST acronym for a stroke, so you could check that out. When I do the skill, I'm going to act as though the left side is the patient's weak side. But of course, remember, it could be left or right. So keep that in mind. But you're gonna undress the client, you're gonna stand on the weak side. This is the patient's weak side. So it'll be the left side. Then you're gonna undress the strong side first. Then to dress, stand on the weak side. So that means once you know what the weak side is, you never move from it. And then dress the weak side first. So write this down in a paper and you'll always be good to go. So let us start the skill. Of course, this is open because this is the school. I just finished teaching lab. So hand hygiene, every skill begins with a hand hygiene. Gather supplies. So I have my supplies here, which are socks, long sleeve shirt, pants, and a bath blanket, okay? It's a blanket that I'm gonna use as a bath blanket. Knock, knock, enter, close my privacy curtain, and I'm gonna do my intro. Hi, my name is Stephanie. I'm your CNA for today. I'm here to help you get dressed. Is that okay? Can I see your ID? All right, so now I'm going to begin my skill. This is not a glove skill, okay? But if you were to put gloves on, you would not be penalized, but it's not a glove skill. Now we gotta pay attention to body mechanics, so I'm gonna raise my bed. It's going nice and slow. You raise it to your waist. You don't want to bend your back. In healthcare, there's 3 things you protect: your patient, your back, and your license. So remember I said that the left side was the affected side. So if you look up here, I'm standing on the left. If you forget, take a look, do your L's. Let me lower the head of the bed and I will show you. This bed is just creeping up super slow. Okay, let me show you here. And the patient doesn't have to be lying totally flat, but L's, if you hold it up like this L here is the patient's left-hand side, just in case you're unaware. So now I've lowered the head of the bed. Again, it doesn't have to be totally flat. I'm going to cover with a bath blanket. You never shake, you don't want to do that. You want to lay the blanket on the patient and continue to open it up, okay? I'm just gonna keep unfolding. Ooh, we've got our little arm stuck there. All right, dear, can you hold this blanket for me? I would untie. So look, stand on the weak side, which I am, and undress the strong side first. So I want to provide modesty. I don't want to have the patient stripped naked. So I'm going under the blanket, and the other side is the strong side. So just so you can see, I'm taking it off on this side, the right side first, because that's the strong side. All right, and I'm just passing it. Some students make this really difficult. It does not have to be. I'm passing it under here, and I'm going to roll it towards me. I'm gonna take it off on this side here. And now this is the correct way. Some students start going like this. That is incorrect. Hold it. You wanna roll away from you, and you wanna put in the hamper. So now the patient's naked and you're ready to dress them. So another thing that I would do, of course, if you were going from hospital gown to hospital gown, there would not be a need to ask them what they want to wear. But I woke up this morning, I wanted to wear this outfit, and I'm sure you wanted to wear whatever it is that you're wearing, and patients have the same right. So you could just say any script, okay, that shows that you gave them autonomy and a choice of what to wear. This is the gray flannel shirt you wanted to wear, correct? Okay, all right, so now, I'm dressing. Stand on the weak side and dress the weak side first. So again, I'm not exposing. I'm holding by the wrist. I'm just gonna put this shirt on there, and just put the sleeve on. All right, hold at the wrist, be very gentle with your patient. You're dressing the weak side. Now, I'm gonna show you 2 ways. Now, because I'm mannequin, I'm gonna take some like cheat ways, but in real life, I'll tell you, you probably have to roll someone 3 times to get them dressed. For you to roll a patient, you hold the ankle, the knee, and then you do knee and shoulder, turn them, okay? And I have other videos, I think bedpan and such, where I do that. But say the mannequin, if someone's really light, like your granny, 90 years old, they weigh 70 pounds, you can do like this. You can reach here, okay? Because you don't want to hurt them. You could sit them up, and kind of while you're holding, you could swing the shirt over. But obviously you could see that you won't be able to do this with a 6'1" man, 250 pounds, okay? So for a man like that, you would have to turn them and tuck the shirt. Back here, it's smooth. I'm gonna lie them down gently. And so now, this usually gets students, don't do, my arm bends like this, okay? So just go like so, hold at the wrist always, and because I pulled the shirt over enough, I have enough room. Okay, that's it. Don't fight with this arm, all right? So here we go. Underneath, it's under the blanket because you're never exposing. I'm going to button here. For the sake of teaching, I'm just gonna button the top button, but you would button the entire client's shirt, okay? Let me button a few buttons and notice that, ooh, don't cover your patient's face, don't smother them. Notice that they are never exposed, okay? So I'm just buttoning the shirt here. All right, we're almost done. So these are your favorite socks? Are we doing blue pants and blue socks? All right, perfect. And so what I would do, even though I'm here, the patient's not gonna fall, but just to be super safe, I could put the side rail up right there. And again, not to expose. Now the state exam says shirt, pants, and socks. In real life, you would put underwear on as well. So I'm standing on the weak side and I'm dressing the weak side. So I would go like this. I would get my pants, roll it up. Okay? This is the weak side, and now I'm going over to the strong side. And again, hold by the ankle. The way you hold patients matter. Now, because it's a mannequin, but I'll tell you, you can go underneath, hold the pants and say, can you lift up your waist? And shimmy the pants up. But I guarantee you dressing somebody in bed, they don't have the ability to do that, so you would end up rolling them again, ankle, knee, and turn them. But because it's a mannequin, I will say that, can you lift your waist up for me, please? So again, this is definitely a cheat code. A patient, 99% of your patients aren't going to be able to lift up. You're going to have to turn them, all right? And so now they're fully dressed, and now I'm going to take this off. Roll away, roll this away from me, put in the hamper, and now I'm gonna go into my finishing up steps. Can you, here's your call light. Give me a call once you're all set. I'll put that right here next to you. Are you comfortable? Do you want your head of bed up a little bit? All right, let's make pretend they said yes. Is that okay? Are you comfortable? Now I'm gonna lower the bed low and locked. So your finishing up steps, I have videos about that, are side rails up, call light within reach, the bed low and locked, or whatever the patient is sitting in is locked. If they're in the wheelchair, it's locked. Patient comfort, I've asked them if they're comfortable. I'm gonna open the privacy curtain, leave that open. Supplies, you do something with supplies, be it hamper or trash or clean. That would depend what the supplies are. So let me make sure the bed's at its lowest position here. All right, here's your bedside table. Tony, I'm gonna take this, or you can leave the hamper in the room, because if housekeeping comes by, my privacy curtain's open. I come out of the room, hand hygiene, and I'm all set.